Thanks, Michael. Good evening, everyone. I'd like to thank our Parliamentary Friendship Group co-chairs for their ongoing interest in the issues that will make our cities more productive, sustainable and healthy. It's a pleasure to be here on behalf of the Heart Foundation and the Cycling Promotion Fund to launch our 2015 National Report on Attitudes to Investment in Active Travel. In Australia, there are over 14,000 deaths per year due to physical inactivity. Now, while we're thought of as an active society, Australians struggle to find the time in their lives to participate in physical activity. Lack of physical activity contributes to almost 1/4 of the burden of cardiovascular disease in Australia. More than 1/3 of Australians aged 15 and over do very little or no exercise at all. Since 2001, the proportion and number of Australians doing very little or no exercise has continued to increase. Now, these low levels of physical activity will continue to drive up chronic disease, including heart disease, type 2 diabetes and some cancers. Not only that, but transport congestion is set to cost us billions in lost productivity over the next 20 years, and environmental pollution is also related to our transport system also costs lives and quality of life in our communities. Active travel, which includes walking, cycling and public transport, is an efficient means of incorporating that physical activity into our daily routine as part of the trips we all do to and from work, schools and other destinations. Where conditions are favourable in Australian cities, riding to work is above 20% of all trips to work. Some areas of Melbourne, Sydney, Canberra and other cities have these sorts of mode share figures already now, but there's a big problem. Whether through lack of public support, a lack of visible outcomes or demonstration projects, or simply a lack of informed public debate, decision makers and representatives do not benefit from that social licence that they need to consider more investment in walking, cycling and public transport. Unlike in many other developed nations, that supporting narrative simply doesn't exist. In commissioning this research, the Heart Foundation and Cycling Promotion Fund have specifically sought to find out what the level of support in the community is for the government to invest more in walking, cycling and public transport, to make it safer, more convenient and a simpler option again. So I'm very happy to report to you that strong community support was clearly in evidence in our national survey, and it was expressed in a number of ways. 62% of people believe government should fund walking and cycling infrastructure where there is an upgrade or construction of road infrastructure. 71% of people support more funding for cycling, walking and public transport infrastructure. More than 60% would walk if infrastructure was improved, and women were more likely to report that a lack of infrastructure resulted in them walking less. 44% of people are prevented from cycling due to lack of infrastructure, and 3 in 4 people are not comfortable cycling on roads where there are no separated bike lanes. Close to 2 in 3 children are driven to and from school, with safety concerns and lack of infrastructure cited most commonly. Improvements in walking and cycling infrastructure would encourage at least 1 in 2 people to be more active in travelling to and from public transport. This increased likelihood was consistent across demographic factors, including distance to CBD, gender, age and household income. And finally, the 3 key areas the community believes are important for increased funding are safety of pedestrians and cyclists, separated paths and accessibility to public transport. It's not rocket science, but I think it's really good to have a national survey where we can clearly identify what the community attitudes are. Now, some of these results do mirror closely what we've found in the previous 4 years of the national surveys we've conducted, but it also does demonstrate a level of support for government to focus on active travel along with the more traditional targets for transport investment. Greater investment in walking and cycling is not a silver bullet for many of the costly, intractable issues all governments are facing up to in the years ahead. But it would contribute to better communities, to improvements in road safety, transport outcomes and a better environment, a range of social benefits and, of course, better health outcomes. So, on behalf of the Heart Foundation and the Cycling Promotion Fund, thanks for your interest. And I officially launch and commend the 2015 report on investment in active transport to you all. Thanks.